So I'm Joe Sepulveda. I'm an assistant medical director at Family Health Centers of San Diego, and also the medical director overseeing SUD services for the organization. Right? If you're doing well with a medication that's treating your chronic condition, why would I remove that and hope that you magically do well? It makes no sense, right? What do these medications do? There's a couple of things that they do very well. One, they help reduce cravings, they help reduce withdrawal symptoms, they reduce drug-related overdoses, and I'll go over some data over that. They reduce disease, meaning the transmission of hepatitis, HIV, endocarditis, or the getting of endocarditis. They reduce violent crimes, and they improve treatment outcomes across the board. Just one medication does that, okay? Or three here. What are the three medications that we use to treat opioid use disorder? It's methadone, buprenorphine, naltrexone, and Vivitrol. Okay, so let's start with methadone. What is methadone? Methadone is what we call a full agonist, meaning it stimulates the mu receptor. There's a reason why I say that, and it'll be on the next slide why we talk about why I brought that up. But it's typically a liquid. It's given at an opioid treatment program, meaning that you show up to this place, you dispense the methadone, you take it observed in front of a person, and after a certain period of time when they've established what dose is working for you and how well you're doing, you get what's called take-homes, or the ability to not have to show up on a daily basis to the methadone clinic. Now, what we're trying to do with all these medications is that we're trying to restore you back to normal physiological functioning before you had an addiction, which is depicted here in this graph. And you can see this with what we call the normal range or comfort zone, which is sandwiched between these lines here. And you can see methadone has a very long half-life, so this purple line here indicates that you will stay within this comfort zone for 24 hours or a little over 24 hours. Okay, that's where you want to live. That's where you and me without an opioid use disorder live. Now, if you're below this line, you will feel sick and you will undergo withdrawal symptoms, which is one of the things that fuels a person into further using heroin, for example, or prescription pain pills. So you want to be above this line, but you don't want to be above this top line here, because that's a toxic level. So for methadone in particular, because it's a full agonist, it works pretty much the same as other opioids, meaning that you're still at risk of having respiratory depression if you overshoot the dose, hence why you have to go daily to a methadone clinic and establish the dose. But it's a very good medication. It's not the same thing as using heroin. It does not substitute one addiction for another. They're completely different medications. This is Suboxone, Buprenorphine, and Naloxone, which is a component, two medications that make up Suboxone. It comes in tablet formulation, sublingual strips, as you can see here. There's also another formulation called Sublocade, which I'm not going to touch on too much, but it's an injection that can be given once a month. What do we know about buprenorphine? Well, it works. It works very well. So if you look at the study here, if I give someone buprenorphine, the likelihood that they're going to stay in treatment is significantly higher than if they take placebo and they fall off. Okay. Why is this slide important aside from buprenorphine works really well? Well, it shows here that if you do not take medication-assisted treatment, the likelihood that you will have success in treating and combating your disorder is not very good. So abstinence-only programs generally do not work for the long term. Don't get me wrong, I think they're important. I think they're good scaffolding and support for other people, but in and of itself, it is not going to work as well as when you give someone medication-assisted treatment. It's a safe medication to use. So remember I said if you shoot too high on methadone or you give too high of a dose of fentanyl or any other opioid, you can stop your breathing and die. That doesn't happen with buprenorphine. So you can see here ventilation goes down to zero when you give too high of a dose of fentanyl, but you do not reach that at all with buprenorphine. There's a plateau. So it's a safe medication to use. Okay? The other thing is every time you give a strip of Suboxone to a patient, you reduce the mortality rate by 50, 60% or greater by giving one strip every time. Okay, let's put that into context. What does that mean? Everyone knows that when you have a heart attack, you're given aspirin, right? It helps, right? There have been lawsuits because people have not given aspirin. You reduce the mortality rate from a cardiac event giving aspirin by 20%. That pales in comparison to this. So what am I trying to say? And I'm going to be blunt here. If you prevent someone from getting medication-assisted treatment, you are quite literally killing that person, and you've made a conscious effort that you're doing that. Okay? You are killing an individual. I'm saying conscious effort because you all I'm telling you right now, you've been educated. And the other thing to realize is that buprenorphine at all doses is better than placebo. So Vivitrol. Vivitrol is a non-opioid medication. It blocks the receptors. It prevents heroin or opioids from binding to the receptor. You can see here that it works well. We get a decrease in the amount of positive urines compared to placebo. It also significantly decreases cravings, which is part of the condition that you're treating. On the other side, interestingly, there was a study that was done in federal probation that showed that there was a 50% less use of opioids and less incarceration as a result of just using this medication. And last but not least, Narcan. Narcan is very important to have. Anyone, if you have a family member that suffers from opioid use disorder, if you're on chronic opioid therapy, if you're on opioids and benzos, if you have a history of addiction, you should be prescribing Narcan. This is the one thing that will save lives out there, and will get people into treatment potentially as well when they experience an overdose. And I'll stop there.
Thank you.